This session will be recorded. I would like to get us started. With me today, we have Dr. Alisa Kachikis. She is an assistant professor in the Department of Obstetrics and Gynecology. She's done a lot of research, but also has been an advocate for vaccination in pregnant women. And it's great to have her on the call today. We had last week a session as well that touched on more basic questions. So we're going to try to review the most salient or important issues that we discussed last time, but we're going to add some additional information. My name is Santiago Nema. I'm an infectious disease doctor. I'm a clinical associate professor of medicine in the Department of Medicine, Division of Infectious Diseases. And I've been working closely with the COVID response at UW Medicine. And I'm particularly interested in providing accurate information to patients, families, members of the community who are still on the fence about getting vaccinated. And in this session, we're going to tell you why. I don't know, Alisa, do you want to say a few words or?
Yeah, sure. Thank you so much for having me. We've already mentioned, I'm assistant professor in the Department of OBGYN and work in maternal fetal medicine, which is kind of like high-risk pregnancies, and have been involved in research related to COVID-19 infection in pregnancy, but then also COVID-19 vaccine in pregnancy. And I'm really honored to be here today.
Thank you so much. So just to frame the conversation, I kind of want to share with the audience that so far, we've had in the US more than 600,000 deaths due to COVID, and pregnancy has been associated with a higher risk of complications. That is COVID that tends to be more severe, moderate to severe with adverse outcomes. So we're going to touch on later, but I did want to show an official document, a new dashboard that King County has put together that really shows some amazing data. Amazing in that it showcases the incredible effect of vaccines. So I'm going to give you a snapshot, but this is obviously available to all of us because it's a tool from public health. Perfect. So sometimes we say that an image is 1,000 words, and this is exactly what you see. So in the past 30 days, we've seen cases that have shown us that people who are not fully vaccinated are 7 times more likely to test for COVID, positive for COVID. And they are 49 times more likely to be hospitalized and 32 times more likely to die of COVID-related illness. So these are official numbers. These are not somebody's opinion on the issue. These are true, accurate Seattle, King County numbers. So it's really important, and I would say that this is something that clearly shows you the impact of vaccines. I do want to warn you, when you look at these data online, and again, it's called Vaccination Outcomes King County. When you look at this online, you might be somewhat surprised by the death counts in the vaccinated folks. And remember that, number one, there is a subset of patients, the immunocompromised patients, who are less protected from the vaccine, by the vaccine. They're less protected because they have an immunocompromised system, and that's the rationale for the third additional dose in this population. 2, many hospitals in the area are doing what we call surveillance testing. That is a test that everyone gets regardless of their admission, the reason for admission into the hospital. That is, I could come to the hospital with an infection of my skin on my leg, but I get tested for COVID, and then what we see is that person can be positive but completely asymptomatic, so no symptoms. And that if that person dies from the skin infection, then that gets classified as a COVID death. So there are some limitations to the data. If anything, I would say that the true number is probably lower, because we're capturing all patients that get admitted. Every patient gets admitted to the hospitals. And then there's more data here with different charts, with geography. It's outstanding. A classification by age, and you'll see the predominance of younger folks, right? So this is really important. So what's happening is that early on, the people who would get admitted to the hospital and die from COVID were the elderly. And nowadays, what we're seeing is that most people are actually pretty young. And for the most part, they have comorbidities, but some don't. I recently treated an athlete who is 29 years of age in the ICU. So again, that's something that's occurring. So I'm going to stop sharing now. And then, last time we talked a bit about pregnancy and the importance of this. And we live in an era of misinformation. And that's why we wanted to show you that dashboard. And you can also change the period of time up to go back to January as well to monitor the data. So I kind of wanted to start with Dr. Kachiki with a few questions. And I'm going to say, why should pregnant women, why do we recommend to every pregnant woman to get vaccinated?
Yeah, so that's a good question. And I think, we've been, as have all other departments and divisions, everyone's been really busy gathering data over the last year since the beginning of the pandemic to try to be able to give more factual answers to these questions, and some of them we're still collecting data on. But one thing that is very, very clear in all of the studies is that pregnant people do worse with COVID-19 infection and have a higher risk for severe COVID illness. If you look at that dashboard, which is really cool, if you look at it by infections by sex, you'll find equal distribution. And I think just thinking about how the pandemic has progressed and younger people being having higher rates of COVID-19 infection too is going to impact the people that reproductive age women are around, their kids at home, et cetera. So I think the risk for infection is also changing and their risk for exposure. But kind of looking back on studies that have been published through mainly data from 2020, maybe early 2021. Studies are very, very clear that people who get COVID-19 infection and pregnancy are 3 to 5 times more likely to be admitted to the hospital, admitted to the ICU, require intubation, so machine breathing for you, needing that bypass treatment to kind of ventilate the body without using the heart and lungs, and even death is higher with pregnant people. Now, the one thing I want to highlight in that we talked about last week too was the fact that this is all data based on a different type of variant than we're seeing right now. So a lot of the data from 2020 is kind of that more wild type variant. I think the Alpha variant maybe was around a little bit, but right now with this Delta variant, we're seeing much, much more severe cases even than we saw back in 2020. And that's what these kind of more ominous studies are based on. Right now in the hospitals, and I want to be very, very clear about this, we are seeing many more cases of COVID-19 in pregnancy than we ever saw on the height of the pandemic. We've had a steady admission rate of at least 1 to 2 very, very sick women for the last 4 to 6 weeks, even in the ICU. And we have done very, very early deliveries. We have done that. We've delivered on behalf of the baby. We've delivered on behalf of the mother. So it's a much more dire situation than what we saw last year even. So that's kind of the reason to get vaccinated. And there are some good reasons even just based on the vaccine too.
Excellent, thank you. Are there any scientific data that have been published that show that the vaccine is dangerous to pregnant women, is not safe for them, is not safe for their baby, or affects their fertility?
There are some studies that have been published so far. Now, again, vaccines were rolled out for people who were pregnant or for the general population, including pregnant people, back in December with healthcare workers. So it hasn't been that long. And right now, the people who were pregnant back then are delivering now. So data is still being collected, but there are preliminary data. We have a few registries across the US. We have the VAERS registry, which is kind of like a vaccine adverse outcomes registry, which is often referenced in news reports about pregnant people and adverse events. And there are no big safety signals with that registry. The CDC has a registry through the VSafe app looking at pregnant people who got the vaccine and has not found any association with adverse pregnancy outcomes. They published a pretty large study back in April of 2021 and have over 5,000 people in their kind of longitudinal study, but then thousands and thousands of people that they kind of keep in touch with in terms of just general self-reported outcomes. We published a study looking at short-term vaccine reactions between pregnant people, people who were breastfeeding or lactating, and people who were just planning pregnancy, not pregnant, not lactating, and found that actually pregnant people did really, really well for short-term reactions and better than some of the other groups. So I think there's some really reassuring data to that effect. There's a recent study that was published looking at early pregnancy outcomes, also by the CDC, and there were no findings that people who got the vaccine were at higher risk for miscarriage. That's always a big concern. And there really haven't been any findings that there's a change in fertility. There's a little bit of interest about changes in the menstrual cycle, which I think will be studied. It sounds like the NIH is interested in looking at that, but there's no thought that that actually affects fertility. It's just an interesting kind of self-reported outcome that some people have reported, but there's very reassuring data right now on fertility and pregnancy outcomes for the vaccine and pregnancy. And there are also some preliminary studies coming out looking at the antibody that is made by the vaccine, the spike protein antibody, and the fact that that actually does cross over the placenta very robustly to the baby. And so that's really great news to hear that potentially, and again, studies are being done right now, but potentially the newborn baby has some protection also that the mom is able to give the baby through the placenta and then also the breast milk. So some really good studies coming out, and there are many more studies that will be published pretty soon.
Excellent, thank you so much. So besides the women, the people really who have had significant adverse reactions to this vaccine, and specifically I'm talking about folks who had anaphylaxis or a life-threatening reaction to the first dose, let's say. So those people aside, that are really, really rare cases, because anaphylaxis is a very rare condition, this severe allergic reaction that affects your breathing, etc. That's extremely rare. But also these are reactions that we see within the first 15 minutes of the injection. So if that should happen to you, then we would be there to assist you. But if you've had anaphylaxis in the past, then we also have the ability to talk to an allergist. But if I don't have that history of anaphylaxis, can you think of any contraindication other than age in a pregnancy, in a pregnant woman?
No, I mean, really is, and other than anaphylaxis and the risk of, not being able to breathe when you get the vaccine. other than that, there is no contraindication to getting the vaccine in pregnancy. And in fact, that is a big recommendation that's being made now by all the large organizations representing OB and prenatal providers in the US. So there are big consensus statements that have come out from organizations that represent the high-risk obstetricians or maternal fetal medicine doctors, obstetrics and gynecology, the nurse midwives, obstetric nurses, the American Academy of Pediatrics. All these organizations have kind of come together and said, you know, we actually recommend that people get the vaccine in pregnancy. So there really is no contraindication to getting the vaccine in pregnancy. And in fact, if you're immunocompromised or you have autoimmune conditions or, you know, a congenital heart condition or lung condition, we really recommend that you get the vaccine. So there really isn't much of a contraindication, medically speaking, to getting the vaccine.
Excellent. Thank you so much. So to summarize, there's really no contraindication to any pregnant woman other than the age limit. The age limit is 12 and above. And although
you were 11 right now, hypothetically,
right,
and pregnant, hypothetically.
Exactly. And then, so there's basically no contraindication other than that lower age or the anaphylaxis. So I understand that a lot of women have concerns because, again, pregnancy is new to them and they're concerned about their babies. One of the questions that comes up when you're pregnant, if I had the vaccine, is that going to change the lactation of that baby? I want to play the two scenarios. One is I got the vaccine, the other one I got COVID. So if I got the vaccine, is there any issues in breastfeeding?
No issues at all with breastfeeding. In fact, if you're able to breastfeed, not all people are able to, so no, pressure. But if you're able to breastfeed, we think that some of the antibodies might actually be helpful for the baby.
Excellent. And if I had COVID?
If you have COVID, breastfeeding is also still recommended, just because, for natural immunity, people do make antibodies also. So breastfeeding is recommended. If you currently have COVID at the same time that you're breastfeeding, you just want to take the normal precautions, which is, wearing masks and trying to distance yourself a little bit from the baby. But the one thing I did forget to mention when I talked about COVID-19 and pregnancy, for people who have COVID-19 who then recover from COVID-19 still pregnant, there is a higher risk of having preeclampsia, which is that high blood pressure in pregnancy, or even having a preterm delivery. So COVID-19 infection in pregnancy actually may impact the duration of your pregnancy and the ultimate outcome of the pregnancy beyond the illness itself.
How does high blood pressure affect pregnancy? So preterm delivery, you mentioned. Any other effects of uncontrolled blood pressure?
Yeah, so if pregnant individuals develop elevated blood pressure, there's a syndrome in pregnancy that is very common that's associated with high blood pressure, which is preeclampsia. That's when blood pressure kind of keeps on rising, and there's a lot of protein in urine, et cetera. It can be a dangerous condition for both the pregnant person and the baby. And so, typically when we diagnose that, we try to give both the baby and the mom medications to help prolong the pregnancy and to help mature the baby's lungs. But sometimes preterm deliveries do need to happen with that. The treatment of that condition would be delivery of the baby in the placenta.
Excellent, thank you. I did want to say a few words about Delta. So how is Delta different? I see Delta different in a couple of aspects. One is the ability to transmit to others, right? So when we have a case of Delta in a patient, we are able technically to give this infection to about 5 people. Now, when we had the Alpha variant, the previous variant of January, let's say, I was able to only give the infection to about 2 people. So we're talking about double the likelihood of exposure. So I could expose more people. The other thing that we see with Delta is that people who get infected with Delta have a high amount of virus in their nose. And again, that has a relationship to the symptoms you get, because the higher the amount of virus, the more symptoms you get and the severity of symptoms. But this is where being vaccinated really pays off, because studies have shown that if I'm vaccinated and I get Delta, true, the initial viral load or amount of virus in my nose is high, but it's high, it remains high for a shorter duration of time. So I'm able to clear that virus faster. And that has an impact as to how many people I can get infected, let alone the benefits that the vaccine has on whether I get admitted to the hospital, get severe COVID, or die from COVID, as we just covered. So that's how Delta is different. It's more contagious. Have to be more careful with others. And in the era of Alpha, we had data from the vaccines that were extremely effective at preventing transmission. With Delta, we are seeing what we call breakthrough infections. That is, I get infected after being fully vaccinated. But the key here is the ability to prevent disease, severe disease, hospitalization, and death. And that's where the vaccines are key. How is Delta similar? Delta is similar in that vaccines still work. They really protect me from getting sick and dying from this. 2, masking still works. Masking works and has worked. And this is why we have 2 requirements here in King County. One was basically instituted a few weeks ago, when everyone has to mask when they are indoors, any public space indoors. Now, as of a couple of days ago, Dr. Duchen from Seattle King County announced a second requirement, which is that the requirement is that we must mask at large outdoor gatherings. That is, if I'm going to a big party, even outside, if I'm going to a concert, I have to mask. And that makes complete sense, because this is a very transmissible variant. So I just wanted to capture those differences. Now, we have currently 3 vaccines in the US that have been approved. Unfortunately, one of them has kind of a shorter supply right now, which is the Johnson & Johnson. I heard that some people fear that because it is an mRNA vaccine, that the genetic code of myself or my baby could change. What do you think of that?
The genetic code changing. I think the way that, most people are getting the mRNA vaccine right now, and what we know from the mRNA vaccine is that it enters the cell, but it kind of tells our cell how to make that spike protein, and then it goes away really quickly. So the mRNA vaccine doesn't even enter the nucleus, which is kind of that control center of DNA in our cells. So the mRNA vaccine actually is a really cool design to help our body make that spike protein. Kind of when you think about the traditional type of vaccines, we've all gotten the hepatitis vaccines and the protein-based vaccines. Often we have to add in some extra ingredients to help our body recognize that protein and make an immune response, but the mRNA vaccine kind of helps our body make that protein. So it's really cool how it works, and I think it's not new. We've been working on mRNA vaccines for decades now. I think it's just the first time it's really been rolled out on a large scale to populations. So I think this COVID-19 pandemic really brought a bunch of brilliant minds together, and we got this vaccine done or out for the COVID-19 vaccine very quickly. So I wouldn't worry about any kind of integration of DNA into your own DNA or your baby's DNA. There was a question about protection of baby. We don't know how long the protection, well, we assume that there's protection. So we give vaccines in pregnancy for different reasons anyway. So we give the influenza vaccine in pregnancy, and we give the Tdap vaccine at the end of the second trimester, early third trimester to help protect baby from whooping cough. And we know that babies do better with that vaccine, so kind of that boost of antibodies at the end of pregnancy. So the thought would be if the COVID-19 antibodies cross over the placenta and protect the baby in a similar way, based on prior studies, and there have been many studies in the past looking at measles protection and other antibodies, typically the protection will last somewhere between 3 to 6 months, but that can be variable, and that is the subject of several studies, including one here at University of Washington, to see how long babies are protected. Now, there are clinical trials also in the pediatric population. I think they go down as low as 6 months of age for kids. So hopefully at some point when we do have a vaccine for kids, 6 months and up can get the vaccine, but we'll wait to see what the FDA says about all that.
Excellent. So currently, how many vaccines are authorized for use for pregnant women? And then when do you recommend that pregnant women get vaccinated?
Yeah, great question. So in the US, it's the same vaccines as for everyone. The Johnson & Johnson, the Janssen vaccine, the Pfizer vaccine, and the Moderna vaccine. In other countries, other pregnant people are getting AstraZeneca and other types of vaccines. I think the bottom line is whatever's available, as long as it's not a live virus vaccine, but there are no live virus vaccines for the COVID-19, the virus specifically. In terms of when to get vaccinated, the way I would think about the COVID-19 vaccine is that it's similar to the influenza vaccine in pregnancy, which is once influenza or flu season starts, we just give it to everyone across the board. You come into our clinic, you do have to be pregnant, but we will give you a vaccine, or we will offer you the flu vaccine because we just don't want you to get the flu while you're pregnant. We know that pregnant people who get the flu have higher risk of adverse outcomes. And so I would think of the COVID-19 vaccine like that. Now with the flu shot, it's a one-time dose, and you already have, a lot of people typically have some immunity to the flu. But with the Pfizer Moderna, J&J is one shot, but harder to get, I think, these days. You need to get those 2 injections, and then it's 2 weeks after that. So it will take about 5 weeks to really have some protective immunity. So we just recommend that anyone get it at any point. Based on data that we have, though, in pregnancy, at least, that first shot is really benign. And then the second shot, there are some side effects that some people experience. But again, with a little bit of fluids and a little bit of Tylenol, typically the effects don't really impact your life.
Yeah, I wanted to touch on the side effects. You know, it's interesting. A lot of people talk a lot about the side effects, and I personally, when I had my turn to get vaccinated, I had Moderna, and the first dose, I really didn't even feel it. I felt the kind of the local pain in my shoulder. The second dose, I was actually feeling pretty tired and achy for about 24 hours. I took some Tylenol and some ibuprofen, and I hydrated myself. And I took a couple of showers because I also had a headache. That's not uncommon. Mm-hmm. But most people really just get the local site kind of pain. But the magical thing is that after 24 hours, the pain just completely went away, and I was kind of back to normal. Whereas when you get COVID, a very common story is that people have very protracted, long, and I'm talking several months of fatigue, brain fog, headaches. It's been really well described, and even at UW, we have studies where we've seen that folks, even 8 months after having COVID, 40% of them are still having some symptom, and often it's fatigue. They're having abnormal dreams. They're having difficulty sleeping, anxiety. So it's just really interesting. So I would say when I got vaccinated, my main feeling, my predominant feeling was, I'm not going to die from COVID. I might get COVID, but I'm not going to die from COVID. I'm not going to be in an ICU on a respirator. And that to me, so then when I had the 24 hours of achiness, it was really worth it to like wake up and, okay, it's done. And I did this. And so I kind of wanted to be transparent that I don't want to tell people that you won't have any side effects. I do think anecdotally, I also heard the same thing that Dr. Kitchikis was talking about. It sounds like most pregnant women may even tolerate the shots better than other adults. So great. How long after COVID vaccine should pregnant women get the flu vaccine? Do you want to answer that?
I don't think there's any clear guideline, or it wouldn't be based on data. There's some thought that, if you could space it out 2 weeks, that would be great. I think that would probably be fine in terms of the priority is COVID-19 vaccine at this point. I think last year we didn't see as much flu because people were masked and socially distancing. So if you could wait 2 weeks, but I think at this point, the recommendation has kind of slipped to just get whatever vaccine you can get when you can get it, with the priority being the COVID-19 vaccine. So delaying the COVID-19 vaccine because you're getting the Tdap vaccine would not be the correct thing to do. You should just get both then at that point.
For non-pregnant individuals, the recommendation is that you can give flu and COVID vaccine at the same time.
Yeah.
But the thing that's a little challenging is if you had a reaction, let's just say, whenever you do 2 therapies at the same time, you might be confused as to what's causing what. But yeah, I would say at this point, we're not seeing a lot of flu. And unlike the flu, COVID, unfortunately, doesn't have a season. That's the issue, right? It's in the summers, in the winters, in the spring. There's a comment here that I would like to address. Weren't you not going to die from COVID without the vaccine either? Serious question. I thought it was 99 whatever % recovery rate. Well, I think it's interesting. I think a lot of the data, I think we've gone from, if you could recall April of 2020, we had a lot of people dying, and that was the original strain, the original variant. Then we got vaccines and we were dealing with Alpha. We saw an incredible dent based on that. In the US, we are seeing deaths now since Delta, and we're actually seeing more pediatric deaths than we've ever seen. So I would say the question is, so yeah, it's true that I will probably survive, me healthy, without comorbidities. I take no medications, etc., that affect my immune system. So I will probably be fine. But when you get vaccinated, well, number one, I don't want to gamble with COVID. I don't want to end up like one of the 90 patients we have currently in our system fighting for their lives. And let me tell you, some of them are much younger than me. I'm 45 years old, and we're seeing people in their 30s on the ventilator. So I don't want to scare you, but it's just factual. This is why it's important to go to that link from public health. And I think it's really, really important to know that. The other piece is that I am a healthcare provider. So the last thing I want is to give COVID to any of my patients, to anybody who might be immunocompromised, elderly, who may get either a breakthrough infection or an infection because they decided not to get not to get vaccinated. And to me, vaccination has a very strong access and rationale in terms of protecting others. It's the same reason I get the flu vaccine. I don't want to get someone really sick who is at risk for a severe complication from flu. I don't want to be standing, in line at the grocery store and be next to a patient who's getting chemotherapy. She got vaccinated, but maybe the vaccine is not as effective because, again, she's immunocompromised, and I might just give her COVID. So I think that we need to think of vaccination as a community effort and not so much as to what happens to me, Santiago, today. And I think that's something that we need to do. Are the odds really high that you will die if you're healthy? No, most people still survive COVID. But why die when it's preventable? Why?
And just to add, I think for healthcare workers who are around COVID patients a lot, I think it's kind of that like, not exactly lottery, but some people do fine with it, but then other people don't. And there's really, I think one thing that's very distinct with the Delta variant is that there's no rhyme or reason sometimes. It's like back in the day, last year, time flies really fast with this pandemic now, but last year we had some commonalities with our patients. Sometimes they were a little bit heavier set and weighed a little bit more. They had asthma, they had some lung condition, and that made them so much more sick. And we would get transfers in from the community to our ICU and pregnancy. Now, the people that we're seeing on our floors are people who totally planned their pregnancy. Some of them have had IVF, they took their prenatal vitamins every day, they planned everything out. They're not like people who have all these conditions, they're normal people, and they just got very, very sick with COVID-19. And I think weighing all the things with knowing the risks of COVID-19 in pregnancy, knowing the safety of the COVID-19 vaccines in the general population, having some really good data about safety in pregnancy, thinking about the benefit to the baby, but then also just like, we wouldn't wish a delivery in our ICU on anyone. So being intubated, having to deliver a baby because the mom is not doing well, the baby's not doing well, early preterm delivery while the mother has no idea what's happening, intubated, she will not be holding her baby, she will not hear her baby cry. The baby will be in the NICU. She may, best case scenario, a few days later, she will maybe find out that her baby was born. But this is not, we really want birth to be a joyous occasion. We do not enjoy doing these deliveries, and we've done more and more of them over the last weeks.
Yeah, and I would like to add that all these restrictions and separations and all of that has to do with the virus that's airborne. It's spread in the air. I mean, it's clear. This is why there's so many outbreaks right now where people go for an innocent dinner with friends and then all of them come back positive. And then the unvaccinated is the group that they're going to do worse. So in my mind, every medical decision and intervention is really about weighing the pros and cons, right? The benefits versus the risk. We have now over 200 million Americans who have received the vaccines. And we have a lot of safety data. We also have transparent dashboards like the one that I just referenced, and we sent the link as well. So I think we all need to think about vaccines in, from an angle of the community. And also, we didn't have this tool, this amazing solution a year ago, right? We only started having it in December. So I really would encourage everyone to get vaccinated. If you happen to be on the call and you're not pregnant, but your spouse is, or you're about to have a baby with a surrogate, you really want to be really, really safe and protect your family, but also protect the community. And that's what we achieve when we all get vaccinated. And this is why these conversations are important, because they're all about science and data and about facts, about real cases. And I would like to thank Dr. Kachikis for joining me in this conversation, where we would very much like to invite her in the future to discuss these topics. I don't know if you have any last comments, Elisa?
No, we just recommend, getting the COVID-19 vaccine today on your way home from work. You can just stop by drugstores and get it. The organizations are very clear right now in the US to go ahead and get the vaccine. If you're planning a pregnancy, you should get the vaccine. There's a recommendation even for people who are gestational carriers to get the vaccine. You just don't want the COVID-19 illness to impact your life anymore. And protect people around you who can't get the same immune response from the vaccine or just can't get vaccinated for whatever reason.
Thank you so much for joining us today. We're going to be sending the link. Also, please invite your family members, friends, patients. We're open. This is why we have this platform that can accommodate multiple people. So please come back with your questions. We want to hear them. And once again, thank you to Dr. Kachikis.
Thank you.
Thank you. Bye-bye.